Hi everyone, Michelle Fix-It here, and Charlie Fix-It, but he's in the bathtub. I'm going to try to multitask a smidge because he does not want to go to bed. It's super late at night. So I was just diagnosed with POTS, which I knew that I had for years, which I've done tons of research on, and all of that stuff. And when I left for my tilt table test, well, I was already diagnosed with POTS from my cardiologist without the tilt table test based off of symptoms and what she was able to personally observe in office. But then I finally got my actual concrete gold standard tilt table test and found out I had things in addition to POTS. And so the thing that I felt that was worth sharing, whether multitasking or not, because again, my son's taking a bath, and I'm going to let him play as long as he wants to. We've been in here for about half an hour already, and when he gets done, we'll take a pause from this video. I am completely watching him. Don't be concerned, but you will not see him because he is in a manner of undress. So back to the point. So the wonderful doctor that gave me the tilt table test gave me some information, and some of this is information that I've already seen through research because I heavily suspected that I had POTS since at least I was 19. I didn't know about it prior to 19. I am clearly not 19 anymore. And so I felt that it was information that I should share with you guys in the event that you are not able to go see the same physicians that I'm able to see and have access to the same research and information, because everything I had was internet, lectures, reviews, seminars, lots of literature, lots of pictures, lots of everything, and videos. So I'm going to read this to you guys, maybe to broaden your knowledge on things that you may not know about, as I didn't know about these things. And then I'll give you like tidbits at the end. So this is general information brochure on orthostatic intolerance and its treatments, revised by Peter C. Rao, MD, from Johns Hopkins Hospital Department of Pediatricians. And this was revised in January of 2001. And that's where I was a little bit shocked, because I thought I would know everything in here, given that I've been researching this condition for years and years. And this is seriously outdated information, considering that it is currently 2023 and we are on the brink of 2024. So, orthostatic intolerance is an umbrella term for several conditions in which symptoms are made worse by upright posture. This document has been prepared for those who requested further information about neurally mediated hypotension, also known as NMH, and postural tachycardia syndrome, also known as POTS, two common forms of chronic orthostatic intolerance. Hypotension is the medical... Sorry, had to grab the baby. Okay, I'm sorry. You look like you were in distress. Hypotension is the medical term for low blood pressure, and tachycardia is the medical term for increased heart rate, also abbreviated to AHR, and blood pressure is abbreviated to BP, which I'm sure they'll go over in this. What are NMH and POTS? Neurally mediated hypotension, NMH, refers to a drop in blood pressure that occurs after being upright. We define NMH by a drop in systolic blood pressure by 25 millimeters HD compared to the BP measured when the person is lying flat. During standing or upright tilt table testing, although NMH may be slightly more common in people with a low resting blood pressure, most people who develop NMH during standing have a normal resting blood pressure. NMH is an abnormality in the regulation of blood pressure during upright posture. It occurs when too little blood circulates back to the heart when people are upright, and triggers an abnormal reflex interaction between the heart and the brain. NMH is sometimes known by the following names: the fainting reflex, delayed orthostatic hypotension, neurocardiogenic syncope, vasodepressor syncope, vasovagal syncope. Syncope is the medical term for fainting. Postural tachycardia syndrome, POTS, refers to an exaggerated increase in the heart rate with standing. A healthy individual usually has a slight increase in heart rate by about 10 to 15 beats per minute within the first 10 minutes of standing. POTS is considered present if the heart rate increases by 30 beats per minute or if it reaches 120 beats per minute or higher over the first 10 minutes of standing. POTS is an abnormality in the regulation of heart rate, not necessarily in the resting heart itself. Some patients with POTS in the first 10 minutes of upright standing or tilt table together and I'm very distracted. Bear with me. Some patients with POTS in the first 10 minutes of upright standing or tilt table testing will go on to develop NMH if the test is continued. The two conditions often are found together, and they are not mutually exclusive diagnoses. How does upright posture lead to these problems? When a healthy individual stands up, gravity causes about 10 to 15% of his or her blood to settle in the abdomen, legs, and arms. The pooling of blood means that less blood reaches the brain, the result of which can be a feeling of lightheadedness, seeing stars, darkening of vision, or even fainting. For most of us, the lightheaded feeling is infrequent when we stand up because the leg muscles help pump blood back to the heart, and because the body turns on a series of rapid reflex responses to make up for the lower amount of blood returning to the heart immediately after standing. The body releases norepinephrine and epinephrine, also known as adrenaline. These substances typically cause the heart to beat a little faster with a little more force, a familiar feeling after we exercise or we are frightened. And norepinephrine causes the blood vessels to tighten or constrict, and the end result... Ducky needed help. And norepinephrine causes the blood vessels to tighten or constrict. The end result is more blood returning to the heart and the brain. Most of the time, we are unaware of these reflex changes in blood flow when we stand up. Pardon me, my angry baby. When people with either NMH or POTS are upright, they appear to pool a larger amount of blood in the vessels below the heart. Compared to healthy individuals, for the person with NMH or POTS, the longer they remain upright, the greater the proportion of their blood that settles in their abdomen and limbs. The body responds by releasing norepinephrine or epinephrine in an attempt to cause more constriction of the blood vessels for a variety of reasons, not all of which are well understood. The blood vessels do not seem to respond normally to these substances, and the vessels either do not constrict efficiently or they dilate. Because the heart remains able to respond to norepinephrine and epinephrine, the heart rate often increases. In those with POTS, the main result of excessive pooling of blood during upright posture is an exaggerated rise in heart rate. In those with NMH, the main result is a reflex lowering of blood pressure. Some of this is caused by a miscommunication between the heart and the brain, both of which are usually structurally normal. Just when the heart needs to beat faster to pump blood to the brain and prevent fainting, the brain sends out a message that the heart rate should be slowed down and blood vessels should dilate further. These actions take even more blood away from where it needs to be in the central part of circulation. At this time, it is not entirely clear why some people develop NMH and some develop POTS, although it may relate in part to the balance of epinephrine and norepinephrine release in the system. Which symptoms can be caused by NMH or POTS? Anytime the brain is getting too little blood flow, the usual result is a lightheaded or spacey feeling. Some people describe this as a head rush. Recurrent lightheadedness is a common symptom of both NMH and POTS. If lightheadedness is severe, individuals may have dimming of their vision, may hear sounds as though they're far away, and may have nausea or vomiting. They may faint because not enough blood is getting to their brain. Fainting is helpful in that it restores a person to the flat position, removing the effect of gravity on blood pooling in the limbs and allowing more blood to flow freely to the heart. Following the episodes of lightheadedness or fainting, most people feel tired for several hours, sometimes more than a day, and their thinking can be somewhat foggy. Some patients with NMH experience prolonged fatigue after a modest amount of physical activity or after sustaining quiet activity like sitting at a desk. This fatigue after exertion or sustained activity can also last 24 to 72 hours and interfere with many daily activities. While fainting has been very distracted. While fainting has been considered a classic symptom of NMH, we have found that many persons who develop NMH during tilt table testing do not faint in day-to-day life. Chronic fatigue, muscle aches, or myalgias, headaches, and mental confusion can be prominent symptoms of NMH in these individuals. The mental confusion takes the form of difficulty concentrating, staying on task, paying attention, remembering, or finding the right words. Some describe being in a mental fog or brain fog. Some develop worse fatigue after mentally demanding activities such as reading or concentrating. This may occur because the blood vessels of the limbs dilate rather than constrict in response to mental tasks, allowing more blood to pool. In persons with POTS, a fast heart rate is a defining feature, and awareness of vigorous or skipped heartbeats, palpitations, is common. In addition, patients can experience lightheadedness, intolerance of exercise, fatigue, visual blurring, weakness, imbalance, headache, shakiness, clamminess, anxiety, shortness of breath, and the same type of mental confusion with those with NMH would describe. It has now been established that there is a substantial overlap between syndromes of orthostatic intolerance on one hand and either chronic fatigue syndrome, also known as CFS, or fibromyalgia, also known as FM, on the other. It needs to be emphasized that all of those with NMH or POTS have It needs to be emphasized that all those with NMH or POTS have CFS or FM, and not all with CFS or FM have NHM or POTS. When do NMH and POTS lead to symptoms? Symptoms of NMH and POTS usually are triggered in the following settings: with quiet upright posture, such as standing in a shower, or even sitting at a desk for long periods. Next, after being in a warm environment, such as in hot summer weather, a hot crowded room. Next, a hot shower or bath. Next, immediately after exercise. Next, after an emotionally stressful event, seeing blood or gory scenes, being scared or anxious. In some people after eating, when blood flow shifts to the intestines during digestion, if fluid and salt intake are inadequate. It is thought that we all would develop NMH provided the environment conditions were sufficiently severe. For example, if we did not take in enough fluids or salt, or we were subjected to extremely prolonged periods of upright posture, or to the very warm environments. The reflex response that, apologies, I thought he was trying to poop. The reflex response that results in lowered blood pressure simply occurs at an earlier point in some individuals. Each person's susceptibility is affected by a number of factors, including genetics, diet, psychological makeup, and the presence of other medical disorders, including infection, inflammation, or allergy. Some people may develop NMH or POTS during tilt table testing, but not be affected much in regular daily life. A person is treated for NMH or POTS when there is enough early triggering of symptoms to interfere with normal activity. How are NMH and POTS diagnosed? NMH and POTS cannot be detected with routine resting blood pressure or heart rate screening. The diagnoses can be made with a prolonged standing test or a tilt table test. Although a 10-minute test is all that is needed to diagnose POTS, this is too brief for diagnosing NMH, which usually requires at least a 45-minute period of upright posture. Many hospitals and academic centers throughout the world perform tilt table testing. It allows careful measurement of the heart rate and blood pressure responses to the heart head-up position, usually at a 70-degree angle in an almost standing position. The usual reason for performing tilt table tests in the past had been for further evaluation of recurrent fainting. Many people with NMH develop adaptations to keep them from fainting, such as crossing their legs, fidgeting, or lying down when they get lightheaded or tired. However, during the tilt table test, they must remain still, and they cannot call upon these natural defenses. As a result, fainting can occur for the first time during the tilt table test. Increased fatigue and malaise often occur for a few days after the test is performed, although our experience has suggested that these symptoms can be minimized if the individual is treated with intravenous saline solution immediately after the completion of the test. What causes NMH or POTS? The answer to this question isn't well understood at present. We suspect NMH and POTS have genetic origins in many people because it is not uncommon for us to find several affected individuals with some form of orthostatic intolerance in the same family. No gene for NMH has been identified, but one rare genetic cause has been found for POTS. A number of persons with NMH or POTS report that their symptoms began after an infection or physical trauma, such as an apparent viral illness, sinus infection, mononucleosis, Lyme disease, a car accident, or a surgery. Other environmental factors also play a role, but more research is needed before we will know what causes either condition. One trait seen with increased frequency in those with CFS, and orthostatic intolerance is excessive joint mobility. Some patients with joint hypermobility have a connective tissue disorder known as Ehlers-Danlos syndrome. The reason for this association between NMH and POTS and joint hypermobility disorders are not yet clear, but these are examples of genetic influences on NMH. And with this, I have to pause again because my son has pooped in the bathtub. That was fun. I have to clean all the stuff. One of the most common and treatable problems identified with those with NMH and POTS is a low salt sodium intake in the diet. Salt helps us retain fluid in the blood vessels and helps maintain a healthy blood pressure. Salt has received bad press in the last couple of decades because a high salt diet in some individuals with high or high normal blood pressure can lead to further increases in blood pressure and thereby to heart disease and stroke. This has led to general health recommendations to cut down on salt. As we are finding, this general recommendation isn't right for all people. In adults, an average blood pressure is 120/70. An adult's systolic blood pressure is the top number. is considered low if it is below 100, and it is considered elevated if it is above 140/90. Individuals can have NMH at a wide range of resting blood pressures. It may be slightly more common in those whose systolic blood pressure is in the 90 to 110 range. For individuals with NMH, a low salt intake may be unhealthy and may move them from feeling good to developing symptoms of fatigue and lightheadedness described earlier. In experimental work earlier this century, severe short-term salt depletion led to fatigue and mental dulling in adult research participants. How are NMH and POTS treated? Treatment of these conditions is often quite challenging because patients have a different mixture of underlying contributors to their orthostatic intolerance. Therapy has to be tailored to the individual and usually requires persistence and willingness to try multiple methods. The approach we use has been based on the available evidence from formal studies and from our experiences treating large numbers of individuals. We use a stepped approach. Step 1 focuses on non-pharmacological treatments. Step 2 involves use of a single medication. And step 3 involves rational and judicious use of more than one medication. Activity and diet recommendations. Avoid prolonged sitting, standing warm environments, and vasodilating medications. Where practical, avoid circumstances that commonly bring on symptoms. For example, shop at non-peak hours to avoid long lines. Take shorter showers and baths and aim cooler water temperature. Aim for cooler water temperatures. Avoid saunas, hot tubs, and lying on a hot beach. Avoid standing still for prolonged periods in hot environments and on very hot days. Flex your leg muscles and shift your weight when you are standing still. You may also want to avoid alcohol because it causes loss of fluids and often leads to dilation of the veins, which can steal blood away from the central circulation. Many with NMH are quite intolerant of alcohol. High carbohydrate meals have been shown to reduce blood vessel constriction in response to upright stress. So a lower carbohydrate intake and frequent small meals may help. Caffeine intake, including caffeine and soft drinks, affects some people with NMH or POTS positively and some in an adverse way. So examine whether caffeine is helping you or making your symptoms worse. I'm taking a pause. That sentence was critical for me, and I hope I remember to go over it. Basically, my cardiologist and my neurologist both were like, hey, you need to drop your caffeine. And I did, and I was non-functional because I require caffeine, not because I have a dependent. I teetered myself off, but I literally couldn't be upright. It wasn't that I had killer head, like it wasn't triggering I could not be upright. It's an important sentence because a lot of the stuff says to get rid of caffeine, and I've tried it many times over the years, and I'm one of those people that need it. An important aspect of treating NMH or POTS is to review your current medications and nutritional supplements with your doctor or healthcare provider to ensure that these do not have the potential to make your symptoms worse. Narcotic medications like codeine, morphine, and oxycodone, and phenothiazine, saying it wrong, so I'm going to spell it for you phonetically. Peter, Hotel, Echo, November, Oscar, Tango, Hotel, India, Alpha, Zulu, India, November, Echo. Antiemetics like Phenergan, Peter, Hotel, Echo, November, Echo, Romeo, Golf, Alpha, November. Compazine can lead to more blood pooling and niacin can cause vasodilation. Many patients develop hypotension when treated with high doses of nortriptyline. November, Oscar, Romeo, Tango, Romeo, India, Peter, Tango, Yankee, Lima, India, November, Echo, amitriptyline, or similar tricyclic antidepressants. Low doses of these medications often are tolerated. Certain postures and physical maneuvers can help reduce NMH and POTS symptoms when people are upright, mainly by using the concentration, of leg muscles to pump blood back to the heart. I started a quotation that didn't finish it. Leg muscles to pump blood back to the heart, and by compressing the abdomen to reduce the amount of blood that pools in the intestinal circulation. These small changes may be important, as even a small increase in blood returning to the heart can help maintain an adequate blood flow to the brain. Many patients have adopted these postures without knowing why. The helpful maneuvers include standing with one's legs crossed, squatting, standing with one leg in a chair, bending forward from the waist, such as leaning over a shopping cart, sitting in knee-chest position, leaning forward with hands on knees when sitting. Some of these postures are less conspicuous than others. Sitting in a low chair, such as a camping stool, is helpful because it causes the legs to be brought up towards the abdomen and probably reduces the amount of blood pooling in the intestinal circulation. For similar reasons, avoid sitting in a high chair with legs dangling freely, as there is no resistance to blood pooling unless the muscles are actively contracting. One young woman found she could sit longer without symptoms if she put her feet on a low footrest. This probably required more leg muscle contraction than regular sitting and may have also compressed the abdomen better. Some patients get worse if they adopt these postures, so they may not be right for everyone. Another technique that has shown to help reduce the frequency of fainting and involves 2 minutes of maximum contraction of the arms, gripping one hand with the other and pushing the arms away at the start of lightheadedness. Another time-honored recommendation is to elevate the head of the bed slightly by 10 to 15 degrees so that the head is higher than the feet, a position that appears to help the body retain fluid at night rather than lose fluid into the urine. In the research setting, several studies have shown that if blood vessels can be compressed by the outside, usually tight compression garments or military anti-shock trousers, the abnormal heart rate and BP changes of NMH or POTS can be reduced or eliminated in day-to-day life. Waist-high support hose can prevent some of the excess pulling of blood into the legs. Knee-high support socks can help somewhat, as can garments that increase abdominal compression. These work by preventing excessive amounts of blood pooling in the intestinal circulation, such as abdominal binders and abdominal corsets. Attention to other medical conditions is crucial to ensuring that NMH or POTS treatments are as effective as they can be. In particular, preventing activation of even mild asthma and allergies has been important in keeping patients from developing a worsening of symptoms. In patients with asthma, we usually try to reduce the reliance on albuterol and other beta agonist, Alpha, Golf, Oscar, November, India, Sierra, Tango, in case I said it wrong, inhalers, as these medications can mimic the effect of too much epinephrine and can aggravate NMH in particular. Endometriosis and other painful conditions may aggravate symptoms. An ovarian vein varices in women with pelvic pain are associated with fatigue and worse orthostatic intolerance. Sinusitis, anxiety disorders, and infections of any sort are examples of other conditions that need appropriate medical attention when present. Allergies or delayed hypersensitivities to food proteins, most commonly cow's milk protein, can coexist with orthostatic intolerance, and unless they are addressed, they can obscure any improvements that might otherwise come with medications and postural changes. Dr. Kevin Kelly has identified the following symptoms that should prompt us to think further about the possibility of a food allergy or hypersensitivity. Upper abdominal pain, gastroesophageal reflux, and appetite disturbance, filling up too quickly, picky appetite, sometimes with recurrent mouth ulcers, headaches, sinusitis, and either constipation or diarrhea. If hypersensitivity to a food protein is playing a role, substantial improvements can restrict from diet exclusions or offending foods. We would emphasize that this dietary treatment is not part of the standard treatment of NMH and POTS in our clinic, and is only considered in the basis of the specific symptoms mentioned above. Given the potential dangers of unsupervised diets, be sure to discuss these issues with your doctor or healthcare provider. NMH and POTS are most often treated with a combination of increased salt and water intake. The increased salt and water help ensure that the blood vessels are filled better and that the heart receives an adequate amount of blood during upright posture. We recommend at least 2 liters of fluid per day. Our patients who drink fluids regularly throughout the day seem to do better than those who don't take this task seriously. Keep in mind that prolonged periods of sleeping, more than 12 hours, may interfere with the ability to keep up with fluid needs. We recommend drinking fluids every 2 hours throughout the day. As a result, it is important to have easy access to fluids at work or at school. For those who have been on a low salt intake, we recommend an increase in the amount of salt they add to their food. Specific foods are now conveniently labeled with sodium content for you to check. For some mildly affected individuals, an increased intake of salt and fluids may be all that is needed. Exercise is important in regaining the effects that fitness brings in counteracting NMH or POTS. Because exercise can make NMH or POTS symptoms worse in the period before effective treatment has been found, it must be done carefully at first. When you and your doctor feel that you are ready, begin a regular regimen of exercise, finding something that does not make you lightheaded and doing it for brief periods at first, increasing gradually. For example, one adolescent who had been ill for several years began functioning better once 2 of the NMH medications were working for her. She began exercising on a treadmill, but this made her lightheaded, so she switched to a reclining exercise bike. Although she started with only 2 minutes a day, she increased this in small increments up to 30 minutes 3 times a week after about 3 months. Walking, water jogging, the water acts as a compressing force to counteract blood pooling in the limbs. Stretching, or Tai Chi, or yoga may be gentle ways to ease back into exercise. Remember to warm up slowly and cool down gradually after you exercise. If you plan to exercise outdoors, remember that extreme heat will worsen NMH or POTS. Medications. For those with more frequent or more severe symptoms, the physical maneuvers, dietary changes, and physical therapies of STEP may need to be supplemented by medications. Most of the drugs in common use for NMH and POTS help to improve the ability of the blood vessels to constrict and return blood to the heart when we stand, increase the amount of salt and fluid the kidneys returns to circulation, or alter the release or response to norepinephrine or epinephrine. The treatments listed require persistence, commitment, and the willingness to try several possible drugs and combinations over an extended period of time. Because there is a risk of serious side effects with some drugs, such as an elevated blood pressure, elevated sodium levels, lowered potassium levels, or depression, careful monitoring is required. The following area list of medications that have been used to treat NMH or POTS: medications that increase blood volume. Fludrocortisone, also known as Floridef. Oral contraceptive pills. Erythropoietin, phonetical spelling is Echo Romeo, Yankee, Tango, Hotel, Romeo, Oscar, Peter, Oscar, India, Echo, Tango, India, November. Licorice root. Medications that interfere with the release or action of epinephrine or norepinephrine, beta blockers, for example, atenolol, Alpha, Tango, Echo, November, Oscar, Lima, Oscar, India, or propranolol, Peter, Romeo, Oscar, Peter, Romeo, Alpha, November, Oscar, Lima, Oscar, Lima. Disopyramide, Delta, India, Sierra, Oscar, Peter, Yankee, Romeo, Alpha, Mike, India, Delta, Echo, also known as Norpace. Angiotensin, converting enzyme inhibitors, medications that improve vasoconstriction, stimulants, also known as methamphetamines. You're getting these two in phonetics. I don't even want to try. Mike, Echo, Tango, Hotel, Yankee, Lima, Peter, Hotel, Echo, November, India, Delta, Alpha, Tango, Echo, or Dexa something, or dextroamphetamine, actually, that's what that is. Dextroamphetamine. Epinephrine and pseudoepinephrine, also in parentheses, is Sudafed. Midodrine, also prometine. Theophylline in low doses. Selective serotonin reuptake inhibitors. Prozac, Zoloft, Paxil. These medications may also affect the nervous system, reflex pathways, and NMH as well. Miscellaneous medications. Pyridostigmine bromide, phonetical spelling Peter, Yankee, Romeo, India, Delta, Oscar, Sierra, Tango, India, Golf, Mike, India, November, Echo, bromide. You see, I'm starting to not do well. I'm trying to finish this up. Does treatment cure the problem? It needs to be stressed that when successful, the medications for NMH and POTS usually do not cure the problem. Rather, they help control symptoms. When medications are stopped or when salt intake is reduced, symptoms frequently reappear. Many with NMH or POTS have symptoms resurface or worsen at busy or stressful times, making an oral presentation in class, having company over for Thanksgiving, rushing for a meeting on a hot day and forgetting to drink, when they have an infection or when their allergies are more active. The intravenous infusion of saline solutions has been shown in experimental settings to help reduce symptoms, and the judicious use of IV fluids periodically has a role. Even after successful treatment, many women with NMH and POTS describe a worsening of symptoms in the days around the start of the menstrual period. Some women choose to take birth control pills on a 28-day cycle or continuously, in addition to their NMH or POTS medications. This is done to avoid symptoms related to hormone changes and should be discussed with your healthcare provider. The question of what happens over the long term has not been adequately studied, and the optimal duration of medical treatment is still being worked out. Unfortunately, despite appropriate doses of the available medications for neurally mediated hypotension, some people with NMH or POTS do not experience an improvement in symptoms, and some are intolerant of the medications. This emphasizes the need for more research on this problem. Many adult women who have orthostatic intolerance describe an improvement in symptoms when they have become pregnant, and often describe pregnancy as the time that they felt the best ever. The improvement may be due to an expansion of blood volume that occurs naturally with pregnancy. Finally, we suggest you take an active role in your care. If you have POTS, it might be helpful to learn how to take your pulse. If you have an NMH, you may want to purchase a home blood pressure monitor. We suggest the kind with the cup that goes around your upper arm, not around your wrist or finger. Heart rate and blood pressure do not have to be taken routinely each day. But having this information during flare-ups of symptoms may provide helpful insights. Being able to monitor your blood pressure at home or take your own pulse won't replace visits to your physician or healthcare provider, but may make those visits more productive as the information may reflect how you are responding to a high salt, high fluid diet or to medications. An adult requires between 2,000 and 3,000 milligrams mg of sodium to maintain health. Although health advice in the last 2 decades has suggested that a low salt intake helps prevent heart disease and stroke, many individuals with orthostatic intolerance cannot tolerate this low salt diet. We believe that individuals with neurally mediated hypotension or postural tachycardia syndrome need to take in much higher amounts of salt. The exact amount needed is different for each individual and is often affected by your taste for salty foods, but it is difficult to take too much provided that you have access to lots of fluid and become thirsty. A few individuals have been unable to tolerate an increase in sodium intake without developing increased weight gain, headache, or agitation. Table salt is also an excellent source of sodium, as it has 2,300 milligrams of sodium per teaspoon. Salt tablets are a way of getting enough sodium without dramatically changing the taste of your foods. If you decide to increase your sodium intake with salt tablets, we suggest that you start slowly and work gradually up to 900 to 1,000 milligrams 3 times a day. Some patients tolerate even higher doses. The amount tolerated varies from person to person. By stepping up your dose slowly, you can determine how much is optimal for you within this range. Remember that if you change your diet to increase sodium intake your diet to increase sodium intake from your food, you may not need as many salt tablets. Some of our patients report better tolerance of a buffered salt tablet. The commercially available brand contains 450 milligrams sodium chloride and 30 milligrams potassium chloride. Salt tablets are available without a prescription. As for fluid intake, be sure to drink at least 2 liters of fluid a day. Water is fine, but some prefer sports drinks, which have the added... This one's messed up too. It's supposed to say advantage of a higher sodium content. And other commercially available rehydration fluids contain substantially more sodium than sports drinks. And that's it. And I don't know if you guys are able to tell or not, because now I'm swaying. I'm not swaying because I'm bored. This whole time, from the time that I started reading all of this stuff, I've been sitting on my legs, which I get scolded about whenever I was younger, because they were like, oh, you're going to get pain. Don't do that. And I'm like, okay, well, I don't feel good. I can't sit very long, and if I do, I have to be really compressed. That's in there. A lot of the stuff that I've dealt with for years and years is in there. And so it's like you develop coping mechanisms. You have to be upright. We can't just be like laying down people all the time. And so right now, because I have been upright, and I heavily suspect other stuff, and I will have some videos going on as well, but I do know that, clinically, I have POTS, I have neurally mediated hypotension, I have orthostatic intolerance, or orthostatic hypotension, and dysautonomia. I have a few things that came out during that tilt table test. And right now, I am very lightheaded. And it's been 45 minutes. I mean, it's been a little bit over that because I was upright because I had to, I was in here for about a half an hour, and then, but I mean, to be sitting, moving, doing things, and have to get to the point of having to kind of like rock and do this. And when you start talking about like how people are doing things to keep their blood moving, I find that to be ironic because I think there's a lot of stuff that needs to be looked at with autism, ADHD, and things like that with POTS. Just like a few other things that I've, started to talk about, and it's kind of, I don't want people to bite my head off, but I've learned a lot about medical stuff, and I am an outside-the-box thinker, and I think that there are quite a few things that are overlapping in a lot of different conditions that the doctors are hyper micro focusing on these very specific areas, but they're not talking to the other doctors that may or may not have the same patients that are going on. And somebody thinks it's in the brain, and somebody else thinks it's in the heart, and somebody else thinks that it's a psychological condition. And I think that there's a little bit of interplay with these different things. And just like we're all about spectrums and everything else for different things, like I think we need to start thinking about that stuff. And I wanted to be able to talk about all this a little bit better, but if you guys can't tell by the way that I'm talking right now, I'm feeling incredibly lightheaded. I'm getting visual disturbances and going through the whole 9 yards. So I'm kind of pushing myself a little bit for you guys and moving around and doing things because I'm having these things pop up. And so it's going to be very interesting as I start going through the motions and talking about these different conditions, because sometimes people use a condition as the excuse that they are not going to be functional at all in life. And sometimes people want to hide that condition and develop coping mechanisms and kind of make themselves a little bit more difficult because failure is not an option. And I'm one of those people where since middle school, I have had things going on with me that I consider to be abnormal or the normal for me, and thought that everyone else was dealing with it because, oh, this just runs in families and everything else, because that's what I was told. So therefore, because I did not have another option, I found coping mechanisms, figured out which ones were appropriate in social situations, and found out which ones were not, and did the best that I could, and was working at a serious deficit because medical science, which still has not caught up to everything, because medical science was saying that I was perfectly fine, even though I wasn't. And so I don't cognitively understand how people can get to a point of being completely accommodating to their physical limitation or their mental I don't understand how you can give up and you cannot constantly challenge yourself to go a little bit further, because if you develop coping mechanisms that are unhealthy and then you eventually make your condition worse, like if I just laid down every single time that I was having an issue, then I would end up bedridden. And I read about women that are and men that are from these conditions and from other conditions that I have. And I have children, and so I can't do that. So you'll see all my little perky happy videos, but what you don't see is that I moderate the abilities that I have, and I try to push myself a little bit further each day, and I recognize whenever something has put me further back. Right now, I am worse than I was because I was rear-ended by a hit and run. I'm still recuperating from that. I am almost 2 years out on having a child. Was I better before I had my last child? Yes. Am I significantly worse now? Yes. Am I significantly worse after being rear-ended by a hit and run? Yes. But I have to keep moving forward because failure is not an option, because I have children. When you have children or things that depend on you, you find an inner strength that you didn't know that you had. So if you find my video and you possibly have limited yourself so much and moderated what you do so much by whatever your condition is, whether it's a physical ailment or a mental ailment or something like that, and now you are far worse than you were, I want to take a moment and say, you know what? Reach out for baby steps. Because if you're a POTS patient and you're at the point where you're now bedridden, I'm going to start making some exercise, because I'm at the point where I can't exercise upright. I just can't. Something is way worse with me than it was before. And so I do have to spend a lot of time laying down and recuperating physically from what's going on with me. And then I push myself other times because I have to, because I have 2 children. So I am going to start doing exercises where I am laying down. Recumbent exercises are what's recommended for POTS patients. But when you become really weak, I also almost died of COVID 2 years ago. I came home on oxygen while I was pregnant with my son. So I'm still recuperating from that. I have a lot of things that I'm recuperating from, that the recuperation is just very prolonged. So what I'm getting to is, if you find yourself as someone that is at the beginning portion of this, where like your symptoms are just kind of impacting your life and you don't really know what to do, here you go. If this enlightens you with things that you were not aware of with postural tachycardia syndrome or neurally mediated hypotension, because I did not know about that before my tilt table test, there's a learning curve. We should not have to be our own doctors, our own physicians. And I am very upset right now because there are a lot of very specialized physicians that are changing lives. That, yes, to their credit, they are getting out there and they are holding lectures and seminars and everything else. But for some reason, it's not spreading as fast as it should. Because it took a while for me to figure it out, or me to get to some of that material completely by chance and coincidences, which is why I'm kind of on the fence. I'm wanting to like spread awareness as much as I can, but not for the awareness of like, hey, I have these things, so like you need to accommodate me. But hey, you might have these things and there might be a way to correct it or improve your lifestyle. That's the me that I am. That sentence sounded stupid. But the flip side of that is, once you become so fanciful that you are super specialized and you can literally hold someone's life in your hands, with them being able to live a good life or a great life, or it's a step above the life that they have, then you become so special. And you say, oh, I'm not accepting any insurance, so only the people that can private pay me I will see. And then I'll, they have to try to see if they can get some type of, payment out of their insurance company. Or I won't see the majority of patients. Or I will not bill out the patients, and I won't deal with the insurance, but I'll give them a super bill. So basically, if you don't have money, you can't find a way to improve your life. Sounds real fair, doesn't it? So on one hand, I will overly commend the physicians that are really just trailblazing through these things. And it's not the pot, some of it's pot stuff and some of it's other stuff. But then I will absolutely get angry that it's only available to those that can come up with the money to see them, pay out of pocket, not use insurance, and then maybe get reimbursement. Because you guys were supposed to get into medicine to help, which you're doing. But it should be trying to help for all. And maybe that's why you feel guilty, because you're making all these seminars and stuff to toot the hoon. My symptoms are getting messed up, I can't talk properly. To toot the horn. And here's the thing, is if your patient really has any cognitive abilities, because right now my cognitive abilities are declining because I've been upright for too long. And so if your patient or prospective patient gets to the point where they have no bandwidth to be able to absorb medical knowledge, and I even struggled with some of this stuff, and I know a lot about medical stuff, what's going to happen? They're never going to see you, and their lifestyle is going to continue to decline, unless like they're a super stubborn person like me. And man, oh man, I'm a super stubborn person that's constantly challenging myself, but it's still getting the best of me. So you cut out assisting people on a purely for-profit basis, and I think that's messed up. I know, US of A, capitalism, all that good stuff. It doesn't make it in some situations it doesn't make it practical. Balance it out, maybe. I don't know, maybe that's why you do the seminars. I don't know. I'd love to know why you think it's okay to just not take insurance and make people have to pay a couple thousand to see you for the first time to get blessed with an hour of your time. Because that's what it boils down to. Maybe I'll start just like tooting the horn on it. But that's it. I don't know if this is available online or not. If it is, then what I will do is I will try to link it in the comments. I am not a fanciful person. You will not get any editing out of my videos. I am far too busy and too coping with my life, or trying to cope with my lifestyle stuff to spend the time cutting, clipping, and everything else. Fast forward. If this is helpful to you, let me know. If you want more information on stuff, let me know. Try to include you, and a lot of times I'll be multitasking. So you guys have a great day. I'll see you next time. Bye! Oh, also, Michelle Fix It, in case you forgot. Like and subscribe to the channel. I'm mainly just trying to make this an even number, so that way I know that when I get to it, I'm like, oh, that's a video that I approved, and I don't have to worry about deleting. I know I look ridiculous. It's later. It's like 4 o'clock. It's like 3 o'clock in the morning. Bye!